Welcome to this explainer. Today, we're acting as medical detectives to demystify the complex biochemistry of thiamine and its synthetic derivatives. We're going to find out exactly how they impact metabolic disease, separate the hype from the science, and look at the real cellular mechanisms driving diabetic complications.
Here's our roadmap for today. We're looking at the hidden thiamine crisis, the cellular traffic jam it causes, how benfotiamine impacts peripheral nerves, TTFD's effect on the brain, the paradoxical dangers of treatment, and finally, separating fact from fiction. Let's just jump right in.
Section 1. The hidden thiamine crisis, uncovering the missing metric. We're starting with a massive biological illusion, one that's literally hiding a severe metabolic crisis in plain sight. For decades, we've totally misunderstood the relationship between blood sugar and this essential nutrient.
Get this, a staggering 75% of all patients with type 1 and type 2 diabetes are profoundly deficient in thiamine, also known as vitamin B1, and almost nobody knows it. We aren't talking about a tiny nutritional gap here. This is a fundamental system-wide metabolic failure happening across the diabetic population.
And here's the kicker, it's not your diet. The real culprit is extreme renal wasting. When you have chronic high blood sugar, it actually forces your kidneys to shut down the specific transporters meant to recycle thiamine. So instead of saving it, your kidneys flush out thiamine at 16 times the normal rate if you have type 2 diabetes. For type 1, it's an unbelievable 24 times the normal rate. You're literally peeing out your cellular engine's primary spark plug.
Now, if you or a loved one takes metformin, the standard first-line drug for insulin resistance, pay close attention. Metformin actually competes with and blocks the thiamine transporter right in your gut. Think about what's happening here. It creates this destructive dual depletion pathway. You've got increased washout from the kidneys happening at the exact same time as blocked absorption in your intestines. It's a massive double whammy.
So, why do doctors constantly miss this? Well, standard blood tests fall victim to something called erythrocyte masking. It's basically a diagnostic artifact. When the thiamine in your plasma drops, your red blood cells panic. They aggressively upregulate their own transporters to hoard whatever B1 is left. And since standard blood tests measure the thiamine inside those red blood cells, the results come back looking totally normal. It creates this perfect illusion of health, completely hiding the fact that your vital organs and nervous system are starving.
Moving on to Section 2, the cellular traffic jam, glucose toxicity at the bottleneck. Now that we understand that thiamine is just gone, we need to look at the catastrophic cellular traffic jam this creates. This is where high blood sugar actually becomes toxic.
Without thiamine, you get a massive pileup inside your cells. The breakdown of glucose gets stalled right at an enzyme called GAPDH. And because this excess glucose has nowhere to go, it gets forced to shunt into 4 toxic tissue-destroying pathways. We're talking advanced glycation end products, PK activation, the hexosamine pathway, and the polyol pathway. These are the exact pathways that drive severe oxidative stress and cause the devastating vascular damage we see in diabetic neuropathy and retinopathy.
So how do we fix this bottleneck? Well, high doses of thiamine activate an enzyme called transketolase. Think of transketolase as a traffic cop who suddenly opens up a massive metabolic escape route. It takes that dangerous backlog of toxic glucose intermediates and seamlessly converts them into harmless pentose sugars. You activate transketolase, and you literally starve those 4 toxic pathways of their fuel.
All right, Section 3, benfotiamine and peripheral nerves, the somatic solution. Let's look at our first major clinical intervention, benfotiamine, and see how it tries to open up this exact detour in the body.
Remember how we said standard thiamine absorption gets blocked in the gut? Benfotiamine was engineered specifically to bypass those broken transporters. It's a synthetic, fat-soluble prodrug that passively diffuses right through your intestinal walls. This means it can flood peripheral tissues like your liver, your kidneys, and your peripheral nerves with highly bioavailable thiamine.
But we've got to be real about the clinical data here. While benfotiamine provides excellent, proven short-term symptom relief, reducing the burning and prickling nerve pain in trials like the BDEEP study, it isn't a miracle cure. Rigorous human trials like the 12-month BOND study show that it unfortunately fails to structurally reverse long-term diabetic nerve damage. It also doesn't meaningfully lower HbA1c long-term. So it's an incredible tool for managing painful symptoms, but it hasn't been proven to reverse the entrenched structural disease.
Which brings us to Section 4, TTFD in the brain, crossing the barrier.
what happens when this severe thiamine deficiency is affecting your brain and autonomic nervous system?
Well, benfotiamine actually has a massive blind spot here, and it all comes down to chemical structure. While benfotiamine is fantastic for the body, it's locked entirely in the periphery because it's completely blocked by the blood-brain barrier. TTFD, on the other hand, features a unique true disulfide bond. This specific chemistry acts like a VIP pass, allowing TTFD to easily penetrate the central nervous system and enter the brain completely intact.
Because it reaches the brain so effectively, TTFD is highly sought after for complex conditions like POTS, chronic fatigue, and dysautonomia. It actually restores stalled ATP production right in the brainstem. But look closely at the pharmacology. TTFD doesn't just replenish cellular energy, it acts as a direct dopaminergic stimulant. It actively drives dopamine release in the prefrontal cortex, which induces wakefulness, arousal, and motivation. So when patients report a sudden, miraculous burst of energy, it's partly a metabolic correction and partly a distinct pharmacological stimulation.
Section 5. The paradoxical danger, reigniting the engine. Now, abruptly restarting a stalled cellular engine with these powerful, highly bioavailable molecules sounds great, but it comes with serious biochemical consequences you absolutely need to know about.
When people first start high-dose thiamine, many experience what's called a paradoxical reaction. We're talking about a severe, temporary spike in extreme anxiety, a racing heart rate, and insomnia. A lot of online forums will falsely dismiss these terrifying symptoms as just a harmless detox or a healing crisis. But the science tells a completely different story. This is actually a state of severe physiological stress and dangerous electrolyte depletion. Let's walk through the actual biology of this crash. Just like refeeding syndrome in malnourished patients, giving high-dose thiamine rapidly restarts stalled ATP production. This sudden, massive surge in energy violently reactivates dormant cellular pumps. Those pumps then aggressively pull magnesium and potassium right out of your blood and into the cells. Your serum electrolyte levels completely crash. This removes the calming blocks on your nervous system, sending you into an uncontrolled excitatory overdrive that causes arrhythmias and panic.
Because of this, to safely navigate this therapy, you absolutely must ensure optimal magnesium and potassium levels before you start and monitor them as you go. In fact, without adequate magnesium, the enzyme that converts thiamine into its active cellular form won't even work. You literally cannot solve a thiamine deficit if you have a magnesium deficit.
Finally, Section 6, separating fact from fiction, the medical verdict. Let's step back and impartially evaluate what the clinical data actually proves across this whole landscape.
When we look at the hard evidence, we can clearly separate the hype from reality. Diabetic renal wasting, that's established science. Benfotiamine for nerve pain relief, highly clinically actionable. But the claims that these supplements will structurally reverse advanced neuropathy, that remains weak and unproven in human trials. And using TTFD to cure POTS? Mechanistically, it's brilliant and very plausible, but we still lack the large-scale randomized trials to prove it definitively.
We also have to respect the sheer power of this biology. Remember transketolase, our metabolic traffic cop? Well, while it clears toxic glucose, it also produces ribose 5-phosphate, which cells use to build DNA. So unsupervised, chronic use of high-dose transketolase activators in patients with undiagnosed malignancies carries a theoretical risk of inadvertently feeding a tumor's rapid demand for nucleic acids. These are powerful metabolic therapies, and they require respect and proper medical supervision. Which leaves us with a really profound final thought. Now that we've seen how high blood sugar structurally starves the body of thiamine, driving these catastrophic traffic jams inside the cell, are we content just prescribing drugs that mask the symptoms of metabolic disease? Or, armed with a real understanding of renal wasting, benfotiamine, and magnesium dynamics, is it finally time to intelligently repair the cellular engine itself?